Hi, I'm Dr. Brett Roofs, the State Chairman for the Kansas K-Mom Committee, and I'd like to thank you for volunteering for this year's K-Mom project. This year we've developed some orientation videos to help you during the volunteer process to give you some information in the areas in which you have volunteered. As a volunteer dentist, please watch the video by Mark and Melody Armfield regarding the K-Mom Clinic.
Hello, I'm Mark Armfield, General Dentist in Augusta, Kansas. We wish to thank you for coming to K-Mom and giving your time to help the citizens of Kansas. Our goal is to help adults, that we start triage is starting early. The clinic floor will probably start around 6:30. We try to keep all chairs full at all times. And so you need to be flexible. If you're taking a break, when you come back there may be another doctor at your chair, and so you can find another chair and to start working there. Also, each chair comes with only one stool. So if you and your assistant both wish to sit, which I always do, then you need to bring your own stool. You can leave your equipment there if you wish to. K-Mom supplies equipment. They have the dental equipment and the supplies. You can use their supplies. If you're more comfortable working with your own supplies, you just bring your own stuff. Sterilization marks it special as your equipment, and you get your own equipment back. If you wish to stay a second day and you have brought your equipment, there's security there, there's police, everything will be fine, just like the rest of the K-Mom equipment.
Okay, I'm Melody Armfield from Augusta, Kansas, and I'm one of the leads today. And if you have any questions, please come to one of us and get help. When you get your first patient, you'll hold up a green card and they will bring you a patient. When you're finished, you will hold up the red card and an escort will come and get your patient. When you first get the patient, take the number and the chart away from the patient. We don't want anything in the patient's hands. That way we don't mess up our paperwork. Only write in blue ink on the paperwork so that we can keep track of that, because we photocopy it from day to day. If a patient comes in and they go through triage, they will anesthetize the area that has the worst decay or the area that we want to treat. So your patient should be numb in that area. That's the area you're supposed to work on so that we can treat as many patients as possible. If you have an emergency, please notify the lead. We have oral surgery here, and we also have EMS in the clinic floor with us. If you have the need to anesthetize a patient and get a syringe, please take the needle off, or if you use a scalpel, please take that off and dispose of them in the sharps container that are provided. Also, we don't want to do any pulp caps or any Di-Cal or anything. If the decay is very deep, it's best that we extract it, because we don't want these people to have a problem in the next 6 months because they do not have the funds to take care of it. So no large fillings that are more than 3 or 4 surfaces. We don't want to exceed the 3 surface if we can help it, because we are only going to have issues with that later. We really aren't doing them a great service by doing that. Every patient, there's a peroxide solution to run through. This helps to keep our suction working while we're here in this facility.
And so for patients who wish to have more done, we're trying to treat as many people as possible. We do quadrant dentistry. For anything they want done extra, we won't be able to do it that day. They are more than welcome to come back, wait in line for the second day. Other people in the past have done it, and they have their choice, of operative surgery or for prophies. And then also there is limited endodontics for anterior teeth and abutment teeth. If you have any other questions, you can give any of the leads, ask any of the leads. They're dressed in orange, and your partner beside you would probably be able to help you from years past. Thank you very much for your time, and we appreciate you donating your efforts and your services. Thank you.
And now Kathy Trilley will provide an informational video over sterilization.
Hello, my name is Kathy Trilley, and we are here to talk about infection control at the next K-Mom. The environment at a mom event is considerably different than a private dental office, so we want to take action so that we make sure that all of the patients and volunteers stay healthy and are protected. First of all, from infectious diseases. And we also want to make sure that all the patient care items are safe for use. There are several differences, and so the American Dentist Care Foundation has taken this into consideration by providing us with suction that's twice as strong as what you might find in your dental office. The air is medically clean through our air system, and there's distilled water at every operatory. We also have signs and briefings, and you'll be updated on infection control guidelines once you arrive on site. And there is a hydrogen peroxide solution rinse at the end of your procedure that we'll definitely want to make you aware of. In the next few minutes, we'd like to cover some very important items to help you stay protected during the MOM event. Everyone, first of all, should have a hepatitis B vaccine, and a flu vaccine is highly recommended. All dental care professionals must wear gloves when treating patients, when putting your hands into the mouth of a patient, when touching contaminated surfaces and supplies, or any equipment. If you have special gloving needs, you may want to bring your own, but they will be provided for all of the volunteers. Overgloving and finger cots are prohibited. Because sinks are not available at the dental units at KMOM, we will be using an alcohol hand scrub to use when gloving and degloving. We want to make sure that everyone places a drop into the palm of their hand and covers the hands completely, rubbing your hands and fingers together until the hand gel is completely dry. Remember, we should be using the gel before gloving, after gloving, when you have patient contact. Whenever you have a torn or worn glove, be sure and re-glove after you've used the hand gel. Face masks or chin-length face shields should be worn when treating patients, and it's to protect you from the splatter from handpieces, from prophy angles, or the air water syringe. Eye protection must have eye shields on the sides to protect the eyes and must be disinfected between patients. Patients will all wear safety glasses, and these are provided by KMOM. Protective clothing, and especially scrub tops, are recommended for patient treatment. It's also recommended that you wear hard-soled shoes to protect your feet. The clinic may be hotter or colder than a private office, so be aware of the weather inside the building. All items able to withstand heat are sterilized. There are disinfection wipes at your table that you can use to wipe off the instruments before returning them to the cassette. Instruments should not be held at the dental units. When you are finished using them, transport them to the sterilization area. You'll be given more guidelines on transportation of contaminated instruments when you're on site. If you choose to bring your own personal instruments, you may take them to the sterilization area, and they will tell you how to label them and where to pick them up when they are ready. American Dentistry Care Foundation staff will be disinfecting and cleaning all the water lines at the beginning and end of each day. Just as in your own dental office, be sure and run some water through the air water syringe and the ultrasonic unit before use for a few seconds. Please keep the suction tips up when not in use. When placing the suction tip into the patient's mouth, turn it on and do not let the patient form a seal around the suction tip. Remove the suction tip from the patient's mouth before you turn it off. And also, one last tip, before turning it off, hold up the suction tips and then turn the switch off. There will be solutions in Dixie cups of hydrogen peroxide for you to run through both the HYVAC suction and the small saliva ejector after each patient use. When you are finished at the chair, clean and disinfect your unit, leaving the wipes on the seat of the chair, and that will tell the next professional that the chair is ready to have a new barrier and be ready then to be prepared for the next patient. Thank you, and have a great KMOM experience.
And once again, I'd like to thank you for volunteering at this year's Missions of Mercy project in Wichita, and we'll see you there.